So,
A cleft lip and palate surgery by a team of professional doctors dedicated to saving vulnerable patients suffering from facial deformity in Kaduna, northwestern Nigeria. In Africa, children and adults with facial deformities, basically facial tumor, noma, cleft lip and palate, and others with special need, face discrimination and stigmatization, which sometimes lead the victims to commit suicide or suffer trauma and depression. However, factors like high cost of surgery, poverty, insecurity, illiteracy, and lack of awareness are worsening the situation, causing more vulnerable individuals to suffer stigmatization, discrimination, and even deny potentials by contributing to out of school children syndrome. But as the issue intensified, the Smile Train Foundation put smile on the faces of vulnerable Nigerians by sponsoring free surgeries across the country. Dr. Mohammed, an associate professor and surgeon, who is among the doctors changing the life of the vulnerables in northwestern Nigeria, comment on the root cause and possible solutions to cleft lip and palate.
So it could be inherited, it could be from poor antenatal care, it could be from poor hygiene, okay, right from internet, you could get infected, and then you can have problem. And then sometimes it comes as a condition, as a syndrome. You know, some babies are born with certain syndrome caused by certain things. Maybe they could come with not just the palate. In addition to the palate, they may come with a heart problem, with a heart hole in the heart. They may come with abnormal limbs. They may come with abnormal, either with like Down syndrome. Okay, some conditions are associated with high incidence of this thing happening, like Downs. You know, these Mongols. So you can have them. The patient will now be born with this associated cleft lip or palate. And it can occur equally in male or female. It tends to be more in female males than males, but it also depends on the region, area. Some areas may have more females or some more males. Okay, and it tends to be more common in the rural area than the urban because of for obvious reasons, because of their food, like the food type they take, poor nutrition. So there should be nutritional component that could be from that observation.
Meanwhile, survivors, parents, and even victims who lost their children to the deformity express their trying times while they suffer stigmatization.
Samarin layi ma ya ashe an ce anan gidan an haifi aljani ku fito mana da shi magan shi sai da na yi musu tas na zazzage su sannan aka zo an sai ragon ma hakika da za a mai aka ce a siyar ake yanzu ba ta hakika ake yi ba ta ciwo ake na ce wallahi ba za a sai mai da ragon hakika ba sai an yanka mishi kamar yadda sauran aka yanka musu shi ma ai mutum ne na haifa kuma yadda na ji zafin haihuwarsa shi ma haka na ji zafin haihuwar shi ma a yanka mishi kayan shi.
Gaskiya ni yan uwana lokacin da sun so ni kamar ni amma yan waje suna yawan kyamana saboda me in za a je wani waje haka za su ce ba za a je da ni ba saboda me ni sun gani wani halitta daban ne haka ne ba su gani ba ne haka amma yan uwana gaskiya ko da za a je da ne ake tafiya saboda ko za a ko ana tsokana nan haka za su shiga mun sai inda karfin su ya kare.
Wallahi akwai kala sai dai wani ma ka kauna fuska wani ma yana ganin yaro sai a.
Besides stigmatization, a matron at Ectomy Hospital disclosed that some husbands abandon, abuse, or neglect their wives after giving birth to babies with facial deformities.
Babies, when they come, you see them crying. Honestly, in fact, you pity them because there's no food, and the parents don't know how to take care of them. They don't know how to start feeding them because they have never experienced such a problem before. So that is how we normally encourage them. And some of them, the husband, we sack them, that they have never seen this kind of a thing in their family. It's not their family lineage. And that is the reason why you see most of them, they will be here alone, no husband, The husband will now send them to their parents' house that they cannot withstand this. So we take care of them and then advise them on how to go about.
Similarly, a mother and survivor of cleft lip and palate shared their challenges with the health implications of these conditions.
Uban ba kowa shi nake riƙon abuna. Yanda na gan shi hakan ga ba zan ba kowa shi ba ne, saboda ma yanzu ne ya samu lahiya da bakin shi ko goya shi kai sai ya dinga jini.
Lokacin in na ci abinci iya makallewa ne a sama, saboda lokacin shi ba saman shi a buɗe shi. Amma da aka ma aiki saboda me lokacin in zan kira wani haka lokacin ba zan iya ba, numfashin iya rabuwa biyu ne, wani ya shigowa wani ya fita. Yanzu kamar Adam sa in za a rufe hanci a da ba ruwa ne ba zan san ma a rufe ma hanci saboda ko ina kofa ce.
However, Dr. Mohammed and the matron of Ectomy Hospital advise on potential solutions to prevent or address babies born with facial deformities.
And the advice we normally give them is that whenever they are pregnant, they should go for hygiene. Secondly, they should eat good fruits, because when they take enough fruits, and then they will go for antenatal when they at the earlier stage, so that they will take care of them in the hospital and give them the correct drugs for them to take, and then eat mostly good foods that will bring up the baby.
Like now we're working for the state here and the federal government and the local government here, but none of them are aware. Some are aware, okay? Some are not. They could help because we're working for their population. So if you can have good antenatal care, good hygiene for the pregnant woman, okay, and that could go a long way in helping to reduce it.